Ever since I can remember, since I stopped wanting to be a fireman, I wanted to be a doctor. I was the kind of kid that could never had an expensive toy because I would break it to see how it worked. I was also the kind of kid that was never, still, I would climb the highest tree and jump from a fence and try to, skateboard through an empty pool. And for that reason, I kind of had a lot of experience with orthopedic surgeons. So the mixture of those two things pushed me to where I am right now. You have to go to someone who has the knowledge, has the skill, and has the way to communicate with you. If you want to have your knee replaced, you go see a person that does several of those a year, not the one that does 3 a year. Because again, at the end of the day, as a surgeon, what we're doing is a craft, it's a trade, and the more we do it, the better we are at it. When you're in clinic, you're kind of like playing detective all day, and you're sitting down and you're trying to grasp little bits and pieces of information, and then make a big picture, and then formulate the way you're going to fix that. But it's also a good day when you had those challenging cases in which you're baffled, and you need to do a little bit of research, and you have to go think a little bit out of the box and figure out what's going on. Most of the time I have good days at work because I really do enjoy what I do. It has to do with the whole patient experience, from the moment the patient shows up in your clinic till the moment the patient is discharged from whatever you treated him for. You sit down and listen to your patient, give him a lot of options and a lot of information. Then you do the best in your possibility to have a good outcome. And then you follow through with that. It's actually a myriad of things that come together, but all of those will translate to the patient's experience.